good? Get ready for some really beautiful slides. In 2016, I semi-forced my husband to marry me. Yes, we love each other, but this was about health insurance. Since then, I've also heard of medical divorces. Rising healthcare costs affect everyone, from the jobs we take to how we engage with our health. But what exactly is making it costlier? Medical care is built in 4 major categories: professional services, pharmaceuticals, testing, which includes labs and imaging, and sometimes there are equipment and facility fees. So which of these have seen the largest price increases? Everyone thinks the money is going to doctors, and maybe it is to some, but not me, where I work. Our salaries kept going down. In fact, Medicare reimbursement has gone down across the board and is lower now than it was 20 years ago in actual dollars, and that's in the yellow. The green is what it would be if it just kept up with inflation. Nurses, techs, secretaries, sanitation workers, all have not seen major increases in their salaries either. On the other hand, pharmaceutical costs have gone up significantly in the last 20 years, and we spend more on medications in this country than any other country by at least double. Of the top 20 revenue-producing companies in healthcare, 11 have to do with pharmaceuticals, and the rest are hospital care systems and insurance companies. CVS actually reported similar profits to Amazon a couple of years ago. What about testing? In 2012, Quest pricing for labs was relatively lower, especially compared to outpatient hospital pricing for the same labs. Now, in 2022, in the gold and the red, outpatient hospital pricing and Quest labs have both skyrocketed. And speaking of hospital pricing, the minute you step foot onto a hospital, you're looking at a 3 to 5-fold increase in pricing. These are imaging prices for an out-of-hospital center and an in-hospital center. You can see the prices in the in-hospital center are usually 5 times higher than the out-of-hospital center. Interestingly, neither of these prices include the radiologist reading fees. So unless they expect us to read the studies ourselves, the total price is still unknown. And it doesn't matter if you have good insurance or bad, if you're in-network or out-of-network, your out-of-pocket expenses are increasing. Here are the trends for out-of-pocket costs for a trip to the ED. Your out-of-pocket costs, whether in-network or out-of-network, nearly doubled over the last 10 years, whether you went for a stubbed toe or a heart attack. Also, this doesn't take into account rising deductibles. So, to summarize, insured or not, healthcare costs are rising astronomically, likely due to price gouging of a few industries, namely pharmaceutical, insurance, and hospital care systems. How is this able to happen? They think you have no other option. But today, I will teach you about 3 things you can do to beat the healthcare system.
Wow!
The first is to shop around. If you can, get your care in the middle of the country, where the prices can be less than half of what you would pay in this area. There's also medical tourism outside this country. You pair that with a nice vacation, you might still come out ahead financially. And also it's trendy these days to get your medications in Canada. The second way to beat the healthcare system is to not need it and live a healthier lifestyle. High blood pressure is the most common chronic condition in America, and you can save almost half when you manage it well. Imagine what you can save by not having it at all. In 2018, I had my first child, and I started to research healthy lifestyles. I found this new field in medicine as of about 4 years ago, and it's called lifestyle medicine, and I fell in love with it. I got certified last year. Basically, it's concerned with 6 pillars: diet, nutrition, physical activity, avoiding toxic substances, stress reduction, sleep, and healthy, strong social relationships. It's entirely evidence-based, and it yields extremely powerful outcomes. Lifestyle medicine is the prevention, treatment, and sometimes reversal of bad health outcomes using primary lifestyle modifications as your prescription. In lifestyle medicine, we are thinking about how your lifestyle led you specifically to your current health status, and we educate you about it and then ask you to make changes in those areas for guaranteed short and long-term benefits. And there really are no shortcuts to this. These days, people are more concerned with their health, which is great, but some people will turn to supplements and do nothing more. And then they come to see me and I tell them they have selenium toxicity, and then they stop taking their supplements and their hair stops falling out. But basically, there's nothing that can replace a healthy lifestyle. The third and final way to beat the healthcare system is to bypass it. See all these middlemen in between you and your physician? Just take them out. This is called direct primary care. It saves the family an average of $5,000 per year. Direct primary care, or DPC, is direct access to your physician through any way, including phone calls, texts, email, after hours. You have 1 to 2 hour appointments. You You have same day or next day appointments, unlimited visits, all for a low monthly fee. Your DPC physician is able to unlock low wholesale pricing for your meds, labs, imaging, and specialists. For example, these are the prices, when it comes on, these are the prices per pill of seizure meds from 4 different types of vendors: GoodRx, Walmart, Costco, CVS, Walgreens, and DPC. I bolded the prices of the cheapest, and that's always DPC. The savings can range up to 85x what you would otherwise pay. Even co-pays can sometimes be pricier than what DPC can get you. For labs, my prices at my practice are down at the bottom purple, and they're orders of magnitude lower than what you can currently get anywhere else at either Quest or outpatient hospital pricing. And my comprehensive panel costs my patients about $50 in total. Imaging prices is actually on par with the out-of-hospital prices we saw earlier, except my pricing includes the radiologist reading fee. So what about hospital care? Many years ago, churches started collecting $100 per uninsured parishioner, and they said if one of you goes to the hospital and is hospitalized, we'll cover it. That's actually what health insurance is meant to be instead of this convoluted system we have today. But anyways, this concept grew, and now there are actually secular versions of this health cost sharing, saving my family $20,000 per year. DPC is growing all over the country. Unfortunately for you, in the bottom right, there's only one in this area, which is my practice in North Haven. There's one in Monroe, it closed, it was one, and then there was one in Westport. It's like a health spa, and it was like $200 a month. My prices are $100 a month. I do take some insurances, and if you do have insurance with Medicare, it's $25 a month. I will limit my panel to 300 patients so I can provide all of them that excellent level of service. You all get my cell phone number. I do a 30-minute free consult. I do lifestyle medicine, in-depth assessments. So please come visit me if you want more affordable and better healthcare.